American passengers from the cruise ship hit with hantavirus are back on U.S. soil, quarantining in Nebraska, most of them. Joining us now to help us understand this health emergency is Upstate Global Health Director Dr. Stephen Thomas, who, by the way, a highly regarded infectious diseases doctor. Good to see you, Dr. T.
Nice to see you.
So let's start with, what exactly is hantavirus?
Good question. Yeah, so it's a collection of different viruses that can cause primarily two different clinical syndromes. One is usually in Asia and Europe, and that's called hemorrhagic fever with renal syndrome. And like it sounds, you can have bleeding complications, you can have problems with your kidneys. And then there's another clinical syndrome, which is mostly in the New World, in the Americas, which is called hantavirus pulmonary syndrome, which, as it sounds, can primarily infect the lungs and cause cardiovascular complications.
So I guess how common is it then, the one that would be more applicable, I guess, to us? Is that a good way to phrase it?
Yes, yep, that's a good way to phrase it. So in the U.S., we do see cases of hantavirus pulmonary syndrome, primarily in the Southwest. So New Mexico, Utah, Nevada, these kinds of places. And, you know, the CDC says between like 2013 and 2023, so about over a decade, almost 900 cases that we're aware of. So it's not incredibly common, but it's not zero.
With all this going on, and you see people getting off the ship, and they're in the hazmat suits and the masks and everything, a lot of people are going, uh-oh, it's the next pandemic. It's starting like COVID, people traveling, bringing it back. What are you saying about all of that? You and other health experts that do what you do.
Yeah, you know, it's this very interesting. On one end, you have people who are clearly being triggered from the experience of COVID, which is clearly understandable. And then on the other end, you have people that are like, why are we spending kind of time on this? You know, I'm sort of in the middle in that, as I've said before, you know, as it relates to infectious diseases, the world is a pretty small place, and you can have an infectious disease outbreak or epidemic in one location, and because of the efficiency of travel, somebody who's infected and involved in that can land on, you know, U.S. soil and potentially cause problems. I think the risk is very low right now because the people that we know that were on the ship, or the people that we know that had close contact with people that were on that ship, they are in the appropriate places. They are in facilities that know how to look after them. They are quarantined, or if they have tested positive or they're sick, they're in biocontainment units being taken care of. So I think that that people can relax a little bit because I think the risk is quite low. That being said, we have to maintain vigilance, and as we learn more about who may or may not have been exposed, because some people traveled before the alarm went up, you know, we just have to be vigilant and have to follow this information and see where it leads. But I think right now, the risk to the general population, especially in upstate New York, is extremely low.
Okay. Curious why the American passengers are in Nebraska. I mean, there's a particular reason, right?
Sure. So, you know, the United States, mostly through funding from the federal government, we have facilities that can do research on really high consequence pathogens, very dangerous pathogens. Hantavirus would fall into that category, I think. And so places that can do research on those pathogens. We also have places that can take care of people who have been exposed to these pathogens. You may remember maybe about a decade ago, the Ebola outbreak in West Africa, and how we had people coming to different containment units around the country to be cared for. That's what this place in Nebraska is like. So they have two different facilities, one that they can quarantine people, track their symptoms, see how they're doing, test them if necessary, and then they have another unit where if someone tests positive or someone gets sick, they can actually take care of them. A couple of passengers are at a similar unit at Emory in Atlanta, and they are designed to protect the public. They are designed to protect the staff. They're designed to and be able to provide optimal care to the patients. So they're highly specialized.
Last quick one for you. I mean, do we need to start changing any of our behaviors, especially when traveling? How do we avoid getting hantavirus?
Yeah, so typically the way people get exposed is these animals that get infected, whether it be a mouse or a rat or other small rodents. When they get infected, they can have the virus in their feces or in their urine or in their saliva or other fluids. Those things dry out, and then people unknowingly, maybe they're cleaning up. They might aerosolize them, put them up in the air, breathe them in, or they might have physical contact. That's typically how this virus gets into people. And so basically, if you're in the Southwest, taking precautions when you could potentially be in contact with this sort of material. And the CDC has a great website where they explain exactly how you can clean up this sort of material safely and how to protect yourself.
Dr. T, always appreciate your insight. Thanks so much. We'll talk soon.
Thank you.
Download the WSYR Plus app on your TV to stream News Channel 9 for free. Just go to your smart TV, search WSYR Plus in the App Store, and download to start streaming today.